In Prudential, we always try to put ourselves in the shoes of the patient when we talk about healthcare. And through the lens of a patient, the biggest challenge that people are experiencing when they want to access healthcare in Hong Kong is concern about cost. So it's not necessarily about the absolute expense, the cost of a treatment, but it's more about the anxiety that people feel not knowing before the treatment how much they're actually going to be paying out of their own pocket. So there's uncertainty about the cost of the treatment, there's uncertainty about what's covered under insurance, and therefore there's uncertainty about what people have to pay out of their own pocket. That creates a huge amount of worry and anxiety amongst patients, and it's actually one of the reasons why people decide to delay care. And our recent Patient Voices survey that we conducted across multiple markets in Asia indicated that in Hong Kong specifically, 6 out of 10 patients delays care. And again, worry and anxiety about cost is one of the main reasons why people decide to do that. It's a great question. And listen, it's less about the actual cost. It's more about not knowing the cost beforehand. That's creating the worry and the anxiety. Now, having said that, the survey also indicates that 56% of all people that we surveyed actually found the cost to be higher than what they had initially anticipated. This is something that cuts across all demographics. So there's not one sort of group of respondents that stands out. Everybody is worried because they're worried about what they're ultimately going to be paying for the treatment that they need to undergo. And therefore, 6 out of 10 people decides to delay care. Well, there's no doubt that the more serious the diagnosis, the more worried people will be about the actual cost associated with that and how much they're going to have to pay out of their own pocket. So I think when it comes to minor illnesses or minor diseases, I don't think that people would necessarily be overly concerned about that. But especially when it comes to the more critical situations that people find themselves in, they already start to worry about what the actual cost is going to be. Another important thing to highlight, it's not just about cost, it's also about information. So people really worry because they cannot find the right information about what's wrong with them, what the right treatment path would be, and where and how to best access care. So a lot of people, as a result of that, turn to Dr. Google or increasingly to Dr. AI, right, to find the information that they need rather than turning to a certified healthcare professional because they simply cannot get access to the information that they need to be able to make well-informed healthcare decisions. So cost and uncertainty about cost is an important element, but it's also information and access to healthcare, which is also very challenging for many patients in Hong Kong, but also across the region. We're doing a lot because we believe ultimately we're here to give peace of mind to every patient in Asia and Africa. So we want to make sure that we reassure people that when they do become a patient, and unfortunately all of us one day will become a patient or will be caring for a patient, that people know that they can access quality healthcare in a hassle-free and a worry-free way, but also that they know the medical bills will be paid and there won't be any surprise cost. So a couple of things that we're doing very practically to make that a reality. First and foremost, we fight for fair prices. So we work very closely with our healthcare provider partners to build strategic partnerships and that ultimately allow us to keep those medical costs under control for the benefit of our patients. Secondly, we want to make sure that we improve the information that patients receive about what good care looks like. And thirdly, we want to make sure that people actually get the support that they need to book appointments with healthcare providers, because that's another important pain point that people are experiencing. And if we do all of that well, and we provide the transparency and the clarity about the actual cost of treatment and what people need to pay out of their own pocket, then we can truly say that we've delivered people peace of mind.